Local lockdowns are still a very new tactic, but will they work? There's been huge disparities between infection rates across England. The worst affected local authorities over here, Leicester and Ashford, has seen over 1,000 people infected per 100,000 of the population, while the areas faring best, actually all in the southwest, have had rates as low as 78 per 100,000. You can see that disparity more clearly when you look at this map. The darker colours here show the areas with the highest infection rates. As you can see, it's the southwest that have really done the best throughout this crisis. Whole swathes of the south and the east also not too bad. When it comes to the areas with the highest infection rates, there's the odd one that sits on its own, Leicester, for example, there in the dark blue, but most of them have been clustered together up there in the north and the northwest. Taking a closer look at that region, one of the worst affected areas has been Blackburn with Darwen, with 763 cases per 100,000. It was singled out as an area of concern, but it hasn't been locked down. In neighbouring Lancashire, those local disparities are really on show. The two local authorities here, Preston and Ribble Valley, share a border, but as you can see, they have extremely different infection rates.
If you're saying to me something has to give and local lockdowns are the best tool we have up our sleeve for achieving that, I kind of understand that, as long as it's done with conviction and with the tools in place to really be able to nail things down properly in real time.
The reality is we're just not sure yet whether local lockdowns work. Leicester is the only case study we have. This shows the infection rate in that city over the last 6 weeks. The lighter bar in the middle there shows the date that lockdown was imposed. We've got the 3 weeks before that, the 2 weeks after, and this bar here is the most recent data we have from yesterday. Now, it's the speed at which cases rise which is concerning when it comes to this virus. So that big weekly jump there just before lockdown was of major concern. But since then, the speed at which infections have risen has levelled off, as you can see those bars there, much less steep. So that shows lockdown has definitely had an impact. However, large numbers of people in Leicester are still affected. The Prime Minister said that improved, more localised data means that restrictions in Leicester can now be eased. Local leaders wanted to see it much sooner.
Residents have been contacting me and my colleagues on Leicester City Council asking for information about why their area, their community is being treated in the way that it is. And we weren't able to answer those questions. And what we'd have now is that more granular data that we've been asking for.
Now, it's important to exercise caution with these local figures. Remember, an outbreak in a factory, for example, can substantially impact local infection rates. But they nevertheless show there are complicated decisions ahead for leaders both local and national.